In the heart of Yorkshire.
Hello, Munster Band.
An unbeatable team.
That way.
And stop, we're going to lay you down.
Hard at work 24 hours a day.
Does it count as a daily exercise?
7 days a week.
I can smell it now. It's a really bad burn.
Saving lives.
It might be that we need to put you to sleep in order to try and sort this out.
Helping loved ones.
It's a shocker, that.
Making the community they serve better.
We got you, lad.
You're being such a good boy.
A health service treating anyone.
Car door, house door.
Van door.
Big van door.
Yes.
So it's quite impressive, isn't it?
And everyone.
Oh, you're going to have a good black eye.
Are you, doctor?
A team doing anything and everything for each other.
It's just been mental down here. I will do it. I'll get to it.
We're strong people in Barnsley, you know.
This is Barnsley Casualty 24/7.
You're absolutely all diamonds. Brilliant.
We fixed him.
On shift tonight, Sister Benita.
Sometimes it's just basic survival, really.
Physician Associate Adele.
Anaesthetics are coming down in the next couple of minutes.
And
They might want to put a little stent in to try and prevent a big heart attack happening.
advanced clinical practitioner Chantel.
Is it all that chocolate I eat? Cream cake. Cream cakes.
So, get ready to share a shift.
Hey, come in to me.
With the team at Barnsley Casualty.
Not too sore for you on that.
Sister Benita has just clocked on in recess.
A typical Benita shift is chaos. Oh, it'll be 2 minutes. Unpredictable.
It's this one. Leave over the game.
That's it. And nothing's ever plain sailing. It would be nicer if you could cooperate, seeing as I were trying to help you.
And already every bay is taken.
How much did you want?
He's going to ask the crews to ring them through individually if they need pre-alerting when they set off.
Okay.
With critically ill patients.
I think there's these two, isn't it? Yeah.
A full resource is never good. It's very challenging nursing.
But the team must make room as another emergency is racing in. Worried colleagues dialed 999 when 24-year-old Amna collapsed at work, falling face first.
About 3 to 4 minutes, I was unconscious when she responded. Okay.
Paramedics are concerned about the extent of her head injuries.
Any visual disturbances? No. Do you feel sick?
No.
Any other pain anywhere else?
Just my nose.
On lift, ready, steady. So, Amna, she is 24 years of age. Staff have said that she's face planked on the floor.
Okay, is that where the...
Yeah, but she's got facial injuries to her nose. Apparently the fainting period lasted 3 to 4 minutes.
Amna needs to be urgently assessed for signs of life-changing spinal injuries. It would mean that she'd have to be transferred to an already overstretched resus.
Hopefully they're going to go scan and then ICU.
Hopefully, yeah, they should, yeah.
I'm just going to make that safe in there because it's a crap hole. Yeah, it's a new one.
And they might need to make room for 2. Another emergency is being blue-lighted in. 53-year-old diabetic David woke up struggling to breathe with a severely swollen throat. In cubicle 10, physician associate Adele assesses him.
David. OK, let me have a look. Well done. So I can actually see on your uvula there's some bleeding coming from it.
The uvula is the dangly bit at the back of your throat. Most people might think that's the tonsils, but the tonsils are actually at the side.
Last night, did you go to bed feeling completely fine?
Normal.
OK. You ever had anything like this happen before? No.
I just looked at my hands couldn't breathe. I was blocked. I was still breathing.
And you've been coughing up some blood, but also maybe like retching.
Yeah.
You've only got a small space for air to pass through, so if anything gets in the way of that air coming through, you're going to stop air going into your lungs and providing oxygen to the rest of your body, which is a huge concern.
That painful there?
I just feel it.
Do you think your face is more swollen than normal?
I don't know. I'm a fatty.
We're going to speak to our colleagues, the ear, nose and throat doctors, to come and have a look at you, OK?
But with David unable to breathe, he urgently needs to be moved to resus.
Hang on, because we've got a few in resus at the moment. We're going to... So do you know about him?
That's CT.
Yeah, CT and then the unit.
Tubes.
Tubes going to the unit.
Sister Bonita scrambles to find space for him.
You have to be so careful because things just get thrown all over.
She makes use of the paediatric bay in resus.
You can have sometimes 2-3 patients turn around in here and... Hi, my name's Adele. I'm calling from A&E. Wondering if you would come down and review a patient.
Yeah, I don't want shit.
He's not had anything to eat or drink all day.
Check his blood sugar.
Yeah, Vicky's coming to do it now.
I'm Vicky. Nice to meet you. Yeah, I'm looking after this. Looking after you. All right, love.
ENT is coming down, but also anaesthetics are coming down in the next couple of minutes. Sharp scratch.
If the swelling in David's throat doesn't reduce, his airways could become blocked.
Typical resus today.
With resus full to capacity,
So, got 2 in. Potential neurosurgery to Sheffield.
Yep. This one's
AMU.
just...
That one's just gone up to ITU.
Sister Bonita is juggling patients.
I think there's also potentially 2 knocks, which aren't priority, but when we've got availability, they'll need to come in for a block.
When you get high priority patients that end up in resus, they're the ones that take up a lot of doctor time, a lot of resources, because essentially they're very, very unwell.
I'll get some portable ready to take this young man straight round to CT and up,
Yeah.
and then we'll have choice of a normal bay or an airway bay.
if we need it.
Having nowhere to put very critically unwell patients is never good.
The team need to identify patients that can move on to a ward or even be discharged.
Hello, David. My name's Sam, one of the anaesthetic doctors. How are you?
David is in resus because he's struggling to breathe due to a severely swollen throat.
If I sit up, it just shuts off.
What, it feels like your breathing shuts off?
It does, it just like shuts off.
Okay.
I'm only just feeling...
Can you open your mouth as wide? What we're going to need to do is get the ENT surgeons to come have a look at you with one of their little cameras that they might put in the nose, okay, to see exactly what's going on, because it might be that we need to put you to sleep in order to try and sort this out, okay? Right, give me 5 minutes. Thank you very much.
ENT doctors coming down to do a nasoendoscopy so they can help work out what is going on and also to see if there is any evidence of the airway becoming narrowed.
So, David, we're going to pass a camera through your nose just to have a look inside and see if we can see any swelling in your vocal cords or any airway compromise.
Yeah.
Ear, nose and throat doctor Emilio Giannotti will perform the endoscopy.
We're going to go through the nose. Getting past. Oh, I know it's uncomfortable. Give me a good E.
The camera shows the swelling isn't blocking David's throat.
You can relax now. We've had a good look. Your airway is still patent, so we're just concerned about the uvula. We need to reduce the swelling there. We'll see where we go from there.
Good.
And then I'm going to give you a nebulizer.
But if medication can't reduce the swelling, David may have to be rushed to theatre. It means every bay in Resus is still full.
86, yeah. Crushing central chest pain.
As another patient is rushed in. 86-year-old Pauline was at home alone when she felt pains in her chest.
Right, can I take some blood tests from you first, Pauline?
With Resus at full capacity, advanced clinical practitioner Chantel is caring for Pauline herself.
You're that's putting the candle on.
Yeah.
Oh, I don't like it.
Oh, come on, lass. You'll be fine. I'll look after you. Right,
You
sharp
can't go
scratch.
on short.
So now this is in, tell me about what's happened today then.
Well, I got myself showered and dressed and I was planning what I was going to do today. And suddenly, in the bathroom, I started sweating and yet clammy. And then I couldn't stand up. Came downstairs and managed to get into the sitting room. Sat on the settee and I felt sick.
Okay.
And tight round my chest. And that's when I phoned 111.
Why didn't you ring an ambulance?
Well, I didn't want to bother them. You don't want to bother people.
It's quite scary to come to A&E, so just to put a patient at ease and to try and forget that things are so serious, I think it's really important.
I've not had episodes like that before.
Okay, that's fine.
That's what frightened me.
Yeah.
We all come into emergency medicine to be hands-on, to be quite clinical, to see emergency things. So being in resource is the prime opportunity to be exposed to that.
So when the ambulance crew did an ECG, they found some changes on it, which could mean there could potentially be an underlying heart attack or something going off. If you get them symptoms again, though, while you're here, you need to let us know so we can hit that button and do another ECG. Okay?
You're not keeping me in, are you?
There's a strong possibility that I will be, yeah. You've got a lot going on with your heart, and we need to make sure this is not a warning sign for an impending big heart attack. Okay.
Right.
Another heart attack could be life-threatening.
I've had a bit of a scare today, but they're really good here at hospital.
Pauline must stay in Resus and be closely monitored.
I just need to keep an eye on you for half an hour to make sure that the medicines don't cause you any problems. All right.
Sister Benita is checking on all her patients.
I'm just going to do her obs, make sure her pain's okay.
She needs to try and make space for new emergencies. One of those who might urgently need a bay is 24-year-old Amna. She's being assessed for spinal injuries.
Face that wall. Yeah, is that all right? And back to the middle.
It's sore.
Is it?
Yeah,
okay.
it's sore.
All right.
She collapsed and fell face first at work.
All right. And what you should do is try and lift your head off of the. Perfect.
But it's good news. Amna's injuries look nasty, but it's her nose and not her spine that's injured. She can be treated in majors, where Dad Sadula catches up with her.
What? How are you?
I'm good.
You're okay? Yeah, I'm good, thank you.
My nose, can't wait for them to clean it because it's just full of blood.
Can you breathe through your nose at the moment?
I was finding it difficult.
Junior Dr. Gabriella Marlowe is in charge of Amna's care.
So what's brought you in today, Amna?
Was I hit my elbow
Okay.
into the corner of a desk and the pain was too much for me. I fainted and I'm assuming that I fell face first off my chair and I think I've done some damage to my nose. I'm struggling to breathe.
Yeah.
It feels really clogged up and
Yeah.
my nose feels sore, so I'm trying not to touch it.
That's fine. So what I'll do, I'll have a look on the inside of your nose, make sure that you've not got any swellings on the inside of your nostril and see if there's anywhere in particular where it was bleeding. What I'm looking for is called a septal hematoma. So it's when, you know, the septum is the bit that goes in the middle
Do you
of...
need me to...
No, just it's fine. I don't see broken noses very often in A&E. Sometimes they fall over like Amna did, or sometimes they get in a fight and they break their nose. I'll just get a nasal speculum just to have a bit of a better look.
No worries. That sounds like it's gonna hurt.
Well, the septum is the cartilage that divides your nose, and you can develop a large bruise essentially either side of the septum. And if you look into the nose, it looks like a cherry at the very front of the nose. And the main risks of a septal hematoma is if they're not picked up and drained, it might lead to a septal perforation, infection, and things like that.
I've just let my friends know, and I literally sent them a picture of me, and they were like, "What's happened?" Beth is so funny. She took pictures of me when it happened. Sometimes you just gotta laugh at your trauma. You gotta laugh at life's problems.
I think it's really good that Amina has that attitude towards life. I think when patients have that attitude, they feel better in themselves. And it does help with pain. Laughter is an analgesia. Sorry.
It's all right. Just goes up your nose a little bit.
Yeah, so your septum looks fine, so there's no hematoma there, which is good. And it looks like there's no current bleeding, which is all right.
Great. Amna's blood pressure has been monitored in Casualty. It's not the cause of her fainting.
Because I'm sure that many people like hit their elbows or hurt their knees and they don't pass out as a result of it. So surely my pain threshold can't be that bad that I can't even take a slight knock to my limbs.
Pain can stimulate the vagus nerve, which in extreme cases can lead to an episode of fainting.
If it's something that you're worried about, I'd probably suggest going to GP about it. Because there's no, say, logical explanation, but some people are just prone to those sorts of things. And in a young, healthy person with a healthy heart and no other medical conditions, it wouldn't be something that I would worry about necessarily. So what we'll do, we'll give you some cream to take home to put on the inside of your nose, avoiding blowing your nose, picking your nose, and drinking really hot drinks. Avoid no teas. Yeah, you can wait for it to cool down a bit. But if you're having nosebleeds or if it's continuing to bleed, the hot food and hot drinks can dilate your blood vessels and restart the bleeding.
Great, thank you so much. Thanks for your help.
You're welcome. Take care.
Yep, thank you. You
You're
too.
welcome.
Bye-bye. Every single person that has seen me today has been absolutely fantastic, and at least they actually helped me and really looked after me, and yeah, I'm really grateful for that.
Amna can go home with a checkup booked for 6 months' time. Her nose is healing well. Over in Resus.
Have you had the update?
Yeah, so we're getting one, being split up.
Consultant Dr. James Griffiths briefs the team on a new emergency.
So there's 3 coming in, one with a reduced GCS, but all 3 are on oxygen. So there's been a house fire somewhere in Barnsley. We've got 3 adults coming in. Thankfully no burns, but they've all suffered from smoke inhalation. So we're going to take the worst one from the house fire in here, and then the other 2 could probably just come through assessment. It's that constant, you know, who's the least sick that you can move out or move on and then bring the next one in.
Sister Benita preps a bay.
Right.
Anita,
Yes, love.
are you aware of all what's happening with these patients now?
Yeah, so one coming in, the others are going elsewhere. This chap is going to A floor theatres at Sheffield, but he just needs gas and bits doing, so I'm not arranging transport until he's completely finished.
In the next resus bay, Sister Vicky is monitoring David, who's on a nebulizer to try and reduce the swelling in his throat. If he's stable enough to go home, a bed can be freed up.
It's a lot better. I'm not as suffocated like I was before. It's freed it up a little lot.
No, you sound a lot better.
I'm going to say, you're talking
instantly
better.
It was scary at the beginning.
I'm sure, yeah.
I was definitely relieved to see that he was talking much better and he looked a lot brighter and a lot more comfier, yeah.
So what they call you, dog?
Max.
Max. But it gets you out, doesn't it? I bet it gets you out and about. No. No? All right.
He's in bed more than me.
Is he old then?
Aye, he's 15.
Do you know the plan after this, David?
No.
So you're going to go up to the ward? Yeah, okay. And they'll continue the treatment from there, all right.
With the bay urgently needed, Dr. Griffiths takes David to the ward.
You go, sweetheart, there's your note.
After a couple of days, he was allowed home and is waiting for tests into the cause of his swollen throat. The bay comes free just in time. A patient has arrived from the house fire, but he's not cooperating.
Sorry, Louis.
Sister Benita takes charge.
1, 2, 3. To see a patient that's involved in a house fire isn't something we see a great deal within Barnsley. I'm not interested in why you're here, as in what's gone off beforehand. I'm here to try and help you. It's a challenge and you've got to take it like that. It's tough, it's really tough. If you want to connect his ECG ones, while I take handover check.
The patient needs treating for smoke inhalation, so must stay in resus for now. More space is needed to keep the flow of patients moving in the rest of the department. Paramedics blue light in 89-year-old Joan with her daughter Carol.
You shouldn't be waiting too long. Hopefully.
Consultant Dr. Chris Young assesses Joan's injuries.
Do you know what's happened today? Can you tell us why you've bumped yourself?
I fell out of bed and have a little table outside at bed and I caught my face on that.
So why did you fall out of bed? I'm guessing you've been getting out of bed every day for the last, all your life. So.
But I got to a near edge and when I turned over, I were on the floor.
The patients here in Barnsley are very sort of down-to-earth people. You know, when you ask them something, they're very often quite brutal with their truth when they say things to you. How's your vision with this eye?
All right.
Can you see me okay?
Yeah.
Am I good looking?
I'd
You're not going to answer that one.
I'd better say yes.
Patients here are just good. They're good fun. They like a laugh themselves. Right, okay. So I think we're happy that you've bumped your face. You've not obviously gone over from a great height. Okay, and I don't think you haven't bumped your head anywhere else, have you?
No.
No. We'll do some x-rays of your face, I think.
Yeah.
All right. It's just a nice place to be. The patients are nice to work with.
Have you got headache?
No.
Would have thought you would have.
I would have thought but no, it happened.
You're tough.
In radiology, Joan is checked for any fractures to her face. It shows there are no broken bones. But falls in older people can be due to an underlying heart problem.
Are we all done?
Yeah.
She must wait for more tests to see if the fall has revealed a serious heart condition.
Do you need another pair of hands in here?
Yeah.
Yeah?
In resus, they're still short of bays.
You just need an hour in resus with too many patients and not enough beds.
The good news is the house fire patient has recovered from smoke inhalation.
Part of our duty is we also have to escort people to hospital when they need treatment.
With the patient well enough to leave, the police can take over. Sister Benita can prep a bay for the next emergency, meaning more casualty patients can be seen.
Hi, Millie, I'm on at nurses.
In cubicle 13, Joan is having an ECG to check if her fall is due to a heart problem.
Just shuffle towards me.
Will it lower a bit?
No, they'll not go any lower, unfortunately.
She's
You'll
only
have to do
small.
I know. I'll guide you back.
Dr. Phil Taylor will review the results.
There could be any number of reasons for the fall. They could simply trip.
They're always like this, honestly. Like spaghetti junction.
But given that Joan already has a known heart condition, we wanted to rule out anything heart-related that could have caused her fall.
Right then, Joan, I just need you to stay nice and still, okay, just whilst I get this tracing.
That ain't so long.
Don't, it's very quick, these. Feel all right?
Yeah.
Okay, then. You'll grab a seat then, lovely, whilst I go and get that ECG checked.
Joan and her daughter Carol must now wait to hear if Joan's heart condition has deteriorated.
Oh dear. What a day. Well, at least it's been an outing.
Paediatrics is jam-packed too.
Come on, buddy.
10-year-old Billy has been brought in by his mum after crashing off his bike.
Hey, you can have a seat on those chairs there, mate.
Paediatric nurse Greg makes the initial assessment.
Right, Billy, so you've hurt your finger, mate.
Yeah.
People in Barnsley are very tough. A lot of the young kids as well, they just take everything within the stride. And how did you land when you fell?
I kind of rolled over.
Rolled over. How fast were you going?
Quite fast, and I smacked into this fence.
Did you bang your head?
No.
Is the bike all right? Yeah, skin or heel, bikes won't. I do like broken limbs and lacerations and things like that. Impressive swelling. I like anything where it's a critical situation and you can provide proper help to the child and relieve some anxiety to the parents.
I think it would just got skin one flapping.
It does look dramatic. It's because it's like what we call a degloving injury, so it's where the skin's just peeled back a little bit, all right. If you're seeing the waiting area, we'll get someone to look at you soon, all right, buddy?
Thank you.
I think you've been quite lucky, mate.
Yeah.
But Billy is wondering just how lucky he might get.
I can't go to school. I can't write letters. No, I do. I use my own. Yeah.
Billy will have to wait to see if his sore finger means time off school. Back in Rhesus, 86-year-old Pauline is at risk of another heart attack.
My mother called me Pauline after the Perils of Pauline.
What's
those old films? Pearl White played the Perils of Pauline. And I said, oh, you could have called me Pearl.
Do you not like Pauline?
I've had, it's the Perils I don't
like.
Perils. I've had more Perils. I've had, a triple heart bypass, haven't I?
Yeah.
I've had a new knee, I've had a stroke.
Advanced clinical practitioner Chantel checks the ECG results.
This is the first one, and then this one is the one we've done now, and it's back to normal. So there's something transient going off that's resolved. So it warrants a discussion with cardiology.
In resource, a lot of it is observation and being more proactive than reactive.
So I'm going to speak to the cardiology registrar at Sheffield just about her ECG changes and see if they want to see her.
I just need to do your blood pressure, Flower.
Sister Benita helps keep a close eye on Pauline.
Is my blood pressure all right then?
It is. It's,
I'm taking that blood pressure tablet this morning.
So it's okay on here. And no chest tightness?
No.
No, good. Have you got family in Barnsley?
We're all in Barnsley, except my eldest sister. She lives in Blackpool.
Oh, does she?
I had a stroke the week after my sister. She's 87, I'm 86. She says, you were always one for copying of me. Will I be going home today?
I wouldn't have thought so. I think you'll probably be staying in hospital overnight.
I'm not used to sitting about. I've always been on the go and doing everything for myself, you know.
Yeah, that's fine, thank you. Bye.
We're strong people in Barnsley, you know. Oh, hello.
I'm back now. How are you feeling?
All right, look, I think I could go home.
You think you could go home?
Yeah.
So, your blood tests are back.
Yeah.
There's an enzyme that we detect in your blood when there's something happened to your heart. Okay, it kind of leaks in your bloodstream and we can detect it. And yours has come back a bit raised.
Oh, is it?
Yeah, which means there's probably something going off with your heart. What I mean by that is, one of your coronary arteries, so the vessels that supply oxygen and nutrients to your heart, one of them may be becoming blocked.
Oh, heck.
Okay, which is what we call a heart attack. So, we need to keep you in hospital, I'm afraid.
How long for?
It's up to the doctors upstairs. What I think they want to do is they might want to send you over to Sheffield for an angiogram to see where or if there is a blockage anywhere. And then if there is something, they might want to put a little stent in to try and prevent a big heart attack happening. Okay.
I wasn't expecting all
I know.
this. Is it all that chocolate, are you? Cream cakes.
Oh, you enjoy your cream cakes.
When it comes to supporting a patient, it's a very intimate and vulnerable situation that you never experience elsewhere.
You come for me for a ride.
I have, love.
And I think there's a patient story amongst every patient.
Well, they've been good, they've looked after me. I enjoy having a bit of company now and a nice cup of tea.
Pauline underwent an angioplasty to fit a stent in her heart. She's now back home recovering.
Just have a seat on that one for me.
Over in paediatrics, Billy's dad is joining him to find out how badly his finger is damaged.
So, what have you done?
I fell off my bike.
Off your
I
bike?
hit this railing and fell off my bike.
So, how far can you bend and stretch it? All okay, it's moving well. That's fine.
Emergency nurse practitioner Tony checks there are no broken bones.
Bend that one up for me. Does it hurt doing that?
A bit more, yeah.
And is it where it's scratched that it's hurting? It's not like in the joint? Any pain on that side? On the bony bit? No? What did you just the gravel that you've done
Yeah,
this
I
on?
think I've scraped it.
Just get a bit of wet gauze and... Sorry, I'll be as gentle as I can. So that bit of skin will just come off.
Yeah.
The risk is we having any bit like flap of skin over the top, it might trap anything underneath it, germs or anything like that, so... Not too sore pulling on that.
It hurts a bit.
It hurts a bit. Now we've got it off, I think all we need to do is give a dressing on that. So this stuff that we're popping on first is to stop things sticking to it. Give a couple of these spare ones to take home as well. If that dressing underneath looks a bit dirty, you can just give it a rinse and pop it back on. It's fine. So that's just designed to stop things sticking to it.
Yeah.
But Billy's mum asks a pressing question.
Will it be okay?
Yeah, absolutely. Can carry on doing your homework. Everything is normal. Yeah, you didn't want to hear that, did you?
Come on, then. Thank you. Cheers.
Bye-bye. Bye.
Billy did get one day off school to recover from stiffness after the fall. His finger healed well. In Resus, some patients have been moved on, and Sister Benita can take stock of the newly emptied bays.
Now it's tracking down all the equipment that was here, that is not here.
But it's not long before Resus is put on standby again.
Come out of there. Are you coming to me? I do enjoy my shifts. They keep me on my toes. The emergency bus has gone out here, which means that somebody may well be coming in to that bay, so we'll just free it up in case they need to.
But it's a false alarm.
In all the years I've worked here, it's never been any different, and I don't envisage it'll ever change.
Over in the hub, Dr. Jake Mullen's next patient is back in Casualty for the second time this week.
He's fallen over, and he came in at the time and we didn't find anything wrong with him because the x-ray of his foot was okay. Now he's come back in with increasing pain, so I'm going to go along and see him and see how he's getting on. Is it Colin?
83-year-old former soldier Colin has brought his wife Margaret with him this time.
Not quite passed my driving test with these things.
No, not true.
Yeah. Nice to meet you. I'm Jake. I'm one of the emergency medicine physicians.
Right.
So, I've been having a bit of a read about you. Tell me, what's brought you into A&E?
Well, when I tripped, they were going over. I put my hand on the wall of the house to stop me going down.
He came into the hospital Sunday morning,
Yeah.
and the x-ray of the foot said there were no broken bones, just to go home and rest it. But when he's come home, the foot is swollen, it's red and inflamed, and he can hardly move his foot now.
Detective work and problem solving is the most fun part of the job.
What about your ankle? Is that painful there?
No.
Does feel a bit hot as well.
It's really hot, yeah.
You get to see a problem and try and get to the bottom of it.
I've seen your x-ray. You've had an x-ray today, haven't you? And you've had this ankle replaced, is that right?
Yes, I have, yeah.
When was that done?
April 2014 down in Sheffield.
This over here as well, really quite arthritic. It looks like you might have even broken it previously as well, from just like a stress fracture from walking around so much.
It was in the Coldstream Guards in London.
Oh, okay, wow.
And he's always walked very heavily.
Yeah.
You know, as a result of, I think as a result of that.
Yeah. Fine.
And this is what, well, I think that's been, you know, over the years.
Potentially makes sense.
Yeah.
So you say you were in the guard with the big hats and
yes.
Queen's Guard and shouting at tourists sort of thing.
Yeah, Coldstream.
Behind, yeah.
Colin's a little bit complicated because he's had previous surgery on his ankle. He's had an ankle replacement. And then at some point in the past few years, the plate on the ankle replacement is broken as well, which makes the x-ray even harder to read.
You can see where the plate that's been put on has broken. But considering he had it put in 8 years ago, I don't think it's related. You can actually see the bone here is kind of adapted to the break. So I think that this has just happened over time and it's got nothing to do with him coming today.
He's fallen over, and the automatic thing to do is to look at his ankle and look for the problem there. But actually, I think the problem's in his foot.
This is his x-ray from a few days ago. Okay. I can't see any breaks. I think the most likely thing is it's cellulitis, basically. It looks hot, it looks swollen. But given the recent fall, something I need to consider is something called a Lisfranc injury. It's quite a rare fracture, but when it happens, it can be quite severe.
A Lisfranc fracture affects the bones in the middle of the foot.
So there are some sort of injuries that only necessarily show up when you put your weight through your foot.
Well,
is that something that, as in on the x-ray?
Yeah.
Do you think if I was to ask you to put your weight through your foot and get an x-ray of it, would you be able to do that, or are you not able to? Okay.
This type of fracture can take months to heal, and if not spotted early, can lead to chronic pain.
Okay.
If confirmed, Colin could be facing surgery and a stay in hospital. In Resus, Sister Benita and the team have been juggling patients all day.
Have you not had any dinner?
No, I purposely delayed it.
Oh.
Making sure the most poorly patients...
Right, I need to track the monitor down.
...get urgent treatment.
Chappie went to ITU from there, but they were just chasing down the big monitor. Trying to ensure that these patients are looked after is always in the back of your head. Thank you. There we go, monitor.
Lovely.
It's daunting, terrifying, hard work.
The rest of Casualty is also swamped.
We're getting somewhere now, aren't we?
Well, yeah, because I'm here.
Yeah, that's true.
In Cubicle 3, 83-year-old Colin and his wife Margaret are waiting to hear if his swollen foot is due to a rare fracture. Dr. Mullen has the results.
So, Colin, I've had a look at your x-ray.
Yep.
I can't see any new fractures or anything like that.
I really need to make sure I consider all the other nasty diagnoses it could be.
Since Friday, all that's gone red and swollen, and I can't move my toes.
You can't move your toes?
No.
So actually it's here that's the problem?
I can't feel squashing that in.
You can't feel it?
No.
Okay, if I was to squeeze your hand... Painful,
Yeah,
sorry. If I touch the skin, is that painful?
I can't feel it, really.
Can't really feel it. Okay, fine. Let's get that sock back on.
Yep.
There you go. That foot looks really quite red and swollen. I think he's probably got cellulitis.
If it's not treated quickly, this type of skin infection spreads to other parts of the body.
So you take 2 of these 4 times a day. Okay. I've given you 7 days worth. Okay.
Right.
And I'm also going to book you into clinic in a week's time where they can review you. Is that all right?
You see new problems multiple times a day, every single day, and you have to try and figure out what's going on.
We've done all that today.
All right. If you give this to the receptionist on the way out, they'll book an appointment for you in a week's time. Is that all right?
Yeah, thank you.
Thanks very much. Thank you.
Lovely to meet you both, okay?
Okay.
Look after yourselves.
If we can do that and provide compassionate care for them.
Can you drive this?
I'm not sure. How do you do it?
Brakes off. Just out the waiting room here.
But yeah, it's really satisfying.
Colin returned to outpatients for a follow-up a week later. His foot is healing well.
Antibiotics, okay. Is that all right?
Over in Resus, Sister Benita is making the most of a moment of calm.
Oh, lass. Is it a bad break? It's actually really nice to get those few minutes to talk to patients, because within an A&E, you don't often get that chance.
Are we going to have a look at this leg and see if we can sort it out?
Any shift can be challenging.
Ambulance is booked.
You need to just keep going and make sure the patients are happy and safe.
In cubicle 13, Joan is waiting to discover if her fall is due to a problem with her heart.
Just having a quick look at Joan's ECG, just to do a quick MOT while she's here. It just shows she's got AF, atrial fibrillation, which we already knew.
Dr. Taylor shares the good news.
Right, my dear. The ECG's just shown the irregular rhythm, which we know about. Are you able to stay overnight with your mum?
Well, yeah.
In the house?
Yeah.
Just because, obviously, there's been an injury to the face, and all your observations have been absolutely fine, all your neurological observations have been absolutely fine, but it's more just a belt and braces approach, just to make sure that there's a bit of support, given that you live by yourself. Are you able to do that?
Yeah.
Being in a position where you can provide someone relief, you can improve their health, and you can provide them emotional support in a time of need is incredibly satisfying, I think. Obviously, any worries or anything out of the ordinary occurs, come back in if you're concerned.
Yeah.
All right?
Yeah, thank you.
Okie dokie, and you can be on your way. All right, my dear?
Oh, thank you very much.
All right, see you later.
All diamonds. You're absolutely all diamonds. Brilliant. And the mum. Yeah. Absolutely brilliant.
Fundamentally, that's one of the core reasons why I've gone into medicine, to be able to help people, and it's always nice to get a bit of recognition for that.
Hey, that's all on.
Thank you. You've all been fantastic. Thanks. Bye.
Joan's eye healed well.
Oh. The poor driver. I'm not right good with wheelchairs.
And she's not had to return to Casualty. Sister Benita is reaching the end of a gruelling shift in Resus.
I would love to leave this shift, ideally with no patients, or at the very most, one patient that is sorted and ready to go to the ward. However, a normal shift would be full with 5, so this would, I think anyone would be happy following me in. See you later. Getting to the end of a shift where you walk onto such a large volume of patients, to go home knowing that you've looked after them in the best possible way, that's my job.
I could have run a pub.
And as long as I've done that to the best of my ability and the staff that we've worked with have, then that's a good shift.
She can finally go home and get some rest.
Being part of our team looking after a patient who's so critically unwell, to be able to be one of those people that is key in that situation, that's what makes me do my job.
Now it's the turn of the next dedicated team to keep the doors of Barnsley Casualty open 24/7.
And Casualty 24/7 Every Second Counts is back next Monday at 9. From mortuary to inquest, we follow the incredible work of the coroner in Cause of Death, new Wednesday at 9. It's a Category 1 trauma alert, meaning the helicopter is about to deliver a patient in need. 999 critical condition. Next.